my name is Olga Sirbu. I'm a board-certified behavior analyst and licensed behavior analyst. And in this video, I'll talk about vocal stimming in children with autism. But before we start, as always, I would like to encourage you to give this video a like and hit the subscribe button below so you can benefit from weekly information on the subject of autism. Vocal stimming is one of the most common and often misunderstood behaviors in individuals with autism. If you ever heard someone repeatedly vocalizing sounds like ee, ah, or ha, you may have witnessed what is known as vocal stimming, a form of self-regulation and sensory processing. But for many, this behavior can be puzzling, frustrating, or even disruptive. However, it's important to understand that vocal stimming is neither intentional nor done to annoy others. It's an essential part of how many autistic people experience and navigate their world. Vocal stimming is a deeply personal and internal experience that provides comfort, relief, and connection, just like any other form of stimming, which includes repetitive body movements like hand flapping or rocking. Vocal stimming helps individuals with autism manage sensory overload, process emotions, and even communicate. For many, vocal stimming is not about seeking attention or acting out, but a tool to help manage the complex challenge they face. One of the most common reasons for vocal stimming is sensory regulation. When overwhelmed by the world around them, whether due to too much noise, bright lights, crowd, or even certain textures, smells, vocal stimming offers a way to self-soothe. The repetitive sounds helps get a sense of comfort in a chaotic environment. Vocal stimming can also be a way to manage emotions, particularly those that are difficult to express. When feelings of frustration, anxiety, excitement, or joy arise, vocal stimming can help release or regulate those emotions. Just as some people may pace, cry, or shout in response to intense feelings, vocal stimming provides a non-verbal outlet for expressing and managing internal states. Vocalizing specific sounds like ee, ah can also be an auditory stim. For some, the sound itself can be pleasurable or calming. It can serve as a form of self-stimulation, similar to how a person may enjoy the sound of ticking clock or the sound of a fan. These sounds are not just random. They hold meaning and provide a consistent source of comfort to the person who vocalizes them. Related to vocal stimming is Palilalia, a condition where a person repeats their own words or sounds. Like echolalia, the repetition of words or phrases spoken by others, Palilalia can become a mental loop where the individual struggles to stop repeating certain sounds or phrases. This loop is not a form of deviance, but often a coping mechanism or a way of processing overwhelming thoughts and emotions. Rather than seeing vocal stimming as a behavior that needs to be fixed or eliminated, it's important to view it as an adaptive coping mechanism that serves a valuable function in the individual's life. However, if vocal stimming becomes disruptive or unsafe, there are ways to help manage it without trying to suppress the individual's need for self-regulation. The first step in managing vocal stimming is to understand the triggers. Is it happening during a sensory overload? Is the individual feeling anxious or overstimulated? By identifying the situation that triggers vocal stimming, you can begin to modify the environment or provide support to reduce those triggers. This could include minimizing sensory input, offering sensory breaks, or creating a calming space where the individual can retreat to when needed. Second suggestion is work on communication. Sometimes vocal stimming is a result of frustration with communication. If a person has difficulty expressing their needs, thoughts through words, finding alternative ways to communicate, like sign language, communication devices, or visual aids, can help reduce the need for vocal stimming as a form of expression. For individuals who vocal stimming becomes intense or disruptive, teaching self-regulation techniques can be beneficial. So, the first suggestion, work on teaching self-regulation techniques such as deep breathing, progressive muscle relaxation, or using a calming sensory tool like weighted blanket or a fidget toy can help the individual manage their sensory experiences and emotions without relying solely on vocalizations. Fourth suggestion, instead of attempting to suppress vocal stimming completely, consider ways to make it less disruptive or harmful to others. For example, individuals who vocalize loudly may be encouraged to explore alternative ways of producing sounds, such as humming, which may be less disruptive for those around them. Ultimately, the goal should be to help individuals feel comfortable in their own skin while also minimizing any negative impact on their environment. Many instances of vocal stimming are triggered by sensory overload. So the last suggestion would be create a sensory-friendly environment. This is an effective way to reduce the need for stimming. Can include lowering loud noises, providing soft lighting, or offering a quiet space for the individual to retreat when feeling overwhelmed. At the end, my personal advice to you is, rather than trying to suppress vocal stimming, try to support the individuals in finding alternative ways to express themselves and regulate their sensory experiences while respecting their need for comfort. Thank you for watching, and I will see you in the next video.